Good afternoon. I'm Eric Friedlander, Secretary of the Cabinet for Health and Family Services. And today we're going to talk about addiction and recovery and the possibilities of people in long-term recovery, coming back from sometimes some very dark places. But what we do as a state, what we do as Team Kentucky, to support everyone across Kentucky, because I'm so fortunate to work for a governor who believes in health care. I'm so fortunate to work for a governor who believes in second chances. And so today, what I want to talk about is Kentucky has faced, and the nation has faced, some very difficult issues around addiction, around overdoses, all across the Commonwealth. So we've seen this increase, unfortunate increase, in overdoses. 20%, 30% increases year over year. And so we know we have to directly address these issues. And we've done that. Additional funding for behavioral health and substance use services, our commitment to our core funding in our core communities and our recovery communities and our recovery-ready communities. We have worked across the Commonwealth with partners locally, across the state, and across the nation to make an impact for everyone in this state. Another tremendous partner has been the University of Kentucky, the Kentucky Injury Prevention Center, we call it KIPRIC, who has been a partner with the Cabinet for many years, investigating what could be preventable injuries. And one of the big things we're talking about now is addiction. So thank you. In 1994, we've done a lot of epidemiological studies with the Department for Public Health. But in 2019, we looked at our overdose data, and we knew that we had to do something. KIPRIC helped us launch the FindHelpNowKY.org website. What we found out is when we talked to physicians, primary care physicians, they didn't know where to send people to get help. We needed something in place that could quickly get people to recovery, because the one thing we know, when somebody says yes to recovery, we had better be able to say yes back to them. And so that website made a tremendous difference. Today, what we're launching is the FindRecoveryHousingNowKY.org website. And here's the reason why. We know the importance of stable housing for individuals to be able to engage in their own recovery, to make that long-term commitment and that long-term support that folks need to get to recovery. So we had to have another site where people could search by gender, by location, by zip code, and to be able to find where there were available places for housing for people in recovery, starting their recovery. This, we hope, is the beginning of finding more recovery housing, supplying more recovery housing, and when people say, yes, I'm ready to engage in my own recovery, that we in Kentucky can say yes back. So with that, we're excited about that. We're going to have some other speakers here who come up and tell you more about the website. But it is my honor. This is not usually the way this happens. Those of you who've seen our press conferences before, it's usually the other way around. But today, I get the honor of introducing my governor. My governor, who has been supportive and a leader throughout the pandemic, who has been supportive and a leader in making sure, from his time as the Attorney General until now, to hold folks accountable who need to be held accountable, and to support those folks who need to be supported. Somebody who believes in science, somebody who believes in healthcare, and somebody who believes in second chances, third chances, fourth chances. Governor, thank you. Honored to be a part of Team Kentucky.
Well, thank you, Secretary, and thanks also to Dr. Bunn and everybody at KIPRIC. and to all of our outstanding members of the Cabinet for Health and Family Services, but all of the Team Kentucky partners who have come together today and who have made this happen, who have seen what one of the holes were, one of the needs in getting people better, in trying to close the gaps, and today is a major step that's going to result in not only more people ultimately getting treatment and getting into recovery, but most importantly, staying in recovery. This partnership and this service is critical. It's critical to the health of our people and to the lives of our brothers and sisters all across Kentucky. Because we know all too well in this state that addiction spares no one. If you've lived in Kentucky the last 30 years, you have lost somebody you love and care about due to this addiction crisis. But there is hope, and there is help, and this partnership and this website are here to provide that next step, that next phase of help with this service, with people being able to find housing. We are going to help more people, and we are going to lose fewer people. We're going to have more successful recovery efforts, which means more of our Kentucky brothers and sisters are going to be with us this time next year and the year thereafter. Find Recovery Housing Now, ky.org, will help people at a pivotal moment in their life. It'll help them find safe, stable, and affordable places to stay so that they can focus on their recovery. Let's take a minute to recognize all of those in recovery who are with us today, as well as those fighting this fight in every corner of our Commonwealth. Like the Secretary said, whether it's their first try, second try, third try, fourth try, fifth try, as long as our people are trying, we are here to support them, and we're going to do everything we can to get them better. And everyone that's in recovery, or has a family member, a friend, a coworker, or a neighbor working to overcome addiction, please know we're proud of you. We're here for you. We want to work with you, and we want to help you. That's what Team Kentucky is all about. The Commonwealth is proud to be your partner in this fight against addiction. And this work has been part of my mission since before I was governor. When I served as Kentucky's Attorney General, I put addiction issues, especially the opioid crisis, front and center. I sued more opioid manufacturers and distributors than any other Attorney General across the country. And if I could have found more, I would have sued them too. Because what they did to our communities was devastate them. And it has led to the addiction crisis that we suffer from today. And as it appears, those cases are moving towards settlement with hundreds of millions of dollars that this Commonwealth is likely to see coming forward. We've got to be committed, as I know I was as Attorney General, to making sure every single dollar of those settlements goes towards getting our people better and ending this addiction crisis. And I do believe that we can, and we must believe that we can end it. This crisis arose in our lifetime, has taken too many lives during our lifetime, and I think it's our responsibility to end it in our lifetime so that future generations don't suffer the way we have seen so many suffer. My office oversaw the Docket program, the idea of getting people out of the justice system and into treatment as fast as possible. And as Attorney General, I was the first to steer any settlement proceeds towards recovery facilities. I remember Hope in the Mountains in Floyd County was going to close. They were that close. Those dollars not only kept them open, it helped them become Medicaid eligible, and now they and so many others are helping more people than ever before. If we just go back 6 or 7 years, we were scrambling to find a bed for those that needed that immediate treatment. Today, I believe we have more per capita than any other state, meaning if somebody needs help, we can get it for them. But this is that next phase. After we've had people in treatment, after we've worked to get their life back on track, how do we make sure that we fill those gaps, that we identify the areas where people fall back into addiction and give them a better opportunity to stay in recovery? A few months ago, My administration, in partnership with the Office of Drug Control Policy, thank you, Van, announced $5 million in grant funding to expand treatment and recovery services that are going to tie in well with this, including those for pregnant and parenting women with opioid use disorders. And this past June, we were blessed to announce together the Recovery Ready Communities to help people fighting addiction receive critical resources at no cost. And more than $170 million has been awarded through the Kentucky Opioid Response Effort, or CORE. That goes to treatment. That goes to recovery. It's targeting populations, including people who are getting out of incarceration, so that addiction doesn't drive them back into the place we were just able to let them out of. And we're supporting Kentuckians on their road to recovery with the launch of 4 certified community behavioral health clinics. And we're investing federal block grant dollars in expanding services throughout Kentucky, including recovery housing. Another important piece of this puzzle is helping people in recovery find good, stable jobs. And my goodness, we've never had more jobs in the Commonwealth than we do right now. Breaking every economic development record last year, creating a record 18,000 new high-quality jobs. We're going to create at least the second most jobs we've ever created in a year this year. And what does that mean? We need everybody healthy, everybody back in that workforce, and it also means there is never going to be a better chance at second chance employment and good second chance employment. And just think what happens when we have all the treatment beds that we may need at one point. We have recovery housing to help people stay in recovery, and we got good jobs waiting for people as we're providing them the skills. This may be the best moment we have seen bringing this and other pieces to the table to be more successful in saving our friends and fellow Kentuckians who need our help. So we're also working to reduce addiction and prevent reincarceration through a project that now provides inmates with free transportation. That's one of those last gaps of how do we ensure that people can get to recovery, get to treatment, get to their jobs, and be transported from housing. Listen, this is an important day, but it also can't be the last day, because every time we identify new gaps where people fall out of recovery, we have to figure out how together, like this partnership, we can marshal the resources and have the right programs to provide that support, because every individual we lose to addiction is one person too many. And I'd leave you just with a final story. Oftentimes, I tell about the individual we had to pull from a car overdosing in Lexington, but he thankfully made it. But I was at a event probably 6 months ago. Ran into an individual who introduced himself as a dad of another individual my age that had coached in the same baseball league that I had 4 years earlier. He had been lost in that last year to this crisis. It hits anybody and everybody, and it can hit them everywhere. And I don't know about you, but I don't want to lose one more Kentuckian or one more American to addiction. Scripture tells us, so continue encouraging each other and building each other up just like you are doing already. So to Kiprick, to all of our Team Kentucky partners, thank you. Thank you for caring about one another. Thank you for living out your faith and values. Thank you for dedicating your lives to the service of others. And thank you for this really important step that is going to help a lot of people. So God bless you. God bless the individuals, and be with the individuals that are struggling through recovery, that are fighting addiction right now, and God bless our Commonwealth. So next, I'd like to introduce a fantastic leader and public servant in this field, Jonathan Philpott, Program Administrator of the Kentucky Recovery Housing Network.
Thank you, Governor Beshear. Good afternoon. My name is Jonathan Philpott, and I am the Program Administrator for the Kentucky Recovery Housing Network, housed within the Department for Behavioral Health, Developmental, and Intellectual Disabilities. Our department and this network are committed to expanding access to quality recovery housing throughout the Commonwealth. Research shows that the longer an individual remains in a treatment or recovery environment, the greater their chances are of sustaining long-term recovery. However, people in early recovery are often discharged from programs only to return to the pre-treatment environment where alcohol or other substance use triggers are immediately and repeatedly experienced. For many, recovery housing provides a vital bridge from an inpatient or institutional treatment to recovery communities and independent living. In addition, recovery housing assists people in all stages of recovery by providing a safe, healthy place to live that focuses or refocuses them on their recovery. In an effort to better understand barriers and gaps to recovery housing access, the Department for Behavioral Health, Developmental and Intellectual Disabilities partnered with KIPRIC to assess the landscape of recovery housing in Kentucky. We found that in addition to there being an insufficient number of recovery houses throughout the state, both Eastern and Western Kentucky in particular have a scarcity of recovery housing options. There are also limited housing options for individuals and families with children. The majority of recovery housing owners or operators also reported funding and long-term sustainability as a primary challenge. Recovery housing is important for both the residents of the houses and their communities. Research shows that people who enter recovery housing, when compared to people returning to their community directly after treatment, typically have decreased rates of substance use and incarceration. They're also more likely to have increased rates of employment. In order to address the shortage of quality recovery housing in Kentucky, the Kentucky Opioid Response Effort, or CORE, created the Kentucky Recovery Housing Network, and we became the state affiliate of the National Alliance for Recovery Residences, or NAR. In establishing the affiliate, our mission was to support persons in recovery by improving access to recovery residences through established standards, a fair and transparent certification process, community engagement, education, technical assistance, research, and advocacy. As part of that mission, we have established a monthly recovery housing open call where operators can ask questions, hear presentations on a variety of topics, or get information about available community resources, such as recovery community centers that offer support services such as mutual aid, peer support, and employment and housing resources, or the Kentucky Moms Matter program that provides community outreach and education, substance abuse prevention, and case management services to expecting mothers who are at risk of using alcohol or other substances. We've also provided training opportunities through partnerships with other organizations, such as the Opioid Response Network, who provided training on the social model of recovery and on the language of recovery. As the state affiliate of NAR, we operate a voluntary certification program for recovery residences. The certification process includes a documentation and policy review, an interview with the recovery housing operator and staff, and a site visit, certifying that the recovery house meets the best practice standards published by NAR. We provide technical assistance and support throughout the process. The NAR standard consists of 4 domains, 10 principles, and 31 standards based on the social model of recovery. The 4 domains are administrative operations, the physical environment, recovery support, and being a good neighbor. Certification by the Kentucky Recovery Housing Network indicates to persons looking for recovery housing that a residence is operated ethically, will be clean and safe, will support them in their recovery, and that the residents and the people who live there will be an asset to their community. As part of our commitment to improving access to quality recovery housing, DBHDID has partnered with KIPRIC in the development of findrecoveryhousingnowky.org. Being listed on the site is one of the benefits of NAR certification. In addition, the site will include a certification module, so recovery housing operators can apply for NAR certification from the Kentucky Recovery Housing Network through the findrecoveryhousingnowky.org website, allowing for easy access to and submission of certification materials. In addition to operating the Kentucky Recovery Housing Network, our department's Kentucky Opioid Response Effort and the Adult Substance Use Treatment and Recovery Services branch also provide grants to expand recovery housing and to reduce barriers to accessing recovery housing through rental assistance with programs such as the Access to Recovery program. In conclusion, I would like to thank KIPRIC for partnering with us, and I look forward to having this resource as we expand efforts to improve access to quality recovery housing in Kentucky. With that, I turn it over to Dr. Bunn.
Well, thanks, Jonathan, and good afternoon, everyone. I'm Terry Bunn, Professor of Epidemiology and Environmental Health at the University of Kentucky College of Public Health, and I direct the Kentucky Injury Prevention and Research Center. I'm eager to tell you today about Find Recovery Housing Now KY.org, the website, and how it will function, and how individuals with substance use disorders will benefit from it. But first, I think it's important to explain what the continuum of care looks like for an individual with a substance use disorder. Find Help Now, KY.org, our sister website to this new website that we've developed, addresses the first stage within the continuum of care, which is substance use disorder treatment. And this website right here, Find Recovery Housing Now, KY.org, addresses the second stage, which is early recovery. During early recovery, a person is especially vulnerable to return to use. Up until now, finding recovery housing options has proven to be an issue for many individuals with a substance use disorder for multiple reasons. Maybe the recovery house didn't provide beds for residents with children, or maybe the individual spoke Spanish and there were no Spanish-speaking staff who were on site. In a recovery house, on-site and off-site services such as employment support that Governor Beshear mentioned, as well as those life and social skills classes, are essential to achieve and maintain long-term recovery from substance use disorder. Up until now, there's been really no easy way to locate recovery houses, let alone find a house that's going to meet the individual needs of a person. So what sets this website apart is its ability to provide a list of available beds within recovery houses. It is not just a static list. These recovery houses are updating their available beds on a regular basis. And we hope, similar to Find Help Now, KY.org, it will be on a daily basis. So when you search, you're only going to come up with those recovery houses that have available beds at that time. It's also going to include 40 different search criteria that an individual can search on. For example, you can search Find Recovery Housing Now, KY.org, for recovery houses that accept residents who have been prescribed medications for opioid use disorders. You can find a house with individuals with a history of involvement with the justice system. You can find a house for those who are pregnant or postpartum, and even search for houses where Spanish is the first language that's spoken. We currently, right now on this website, have over 60 houses that are included in the Find Recovery Housing KY.org website. This resource, we believe, actually will be a game changer for those in that next stage of recovery. And we're so optimistic about the potential impact that this website can have on the Commonwealth of Kentucky. We'd like to thank the following partners for their contributions to the development and implementation of the website. First of all, we'd like to acknowledge Apex, who has been integral not only in the development of this website, but also the Find Help Now, KY.org website. When an individual conducts that search, they're the ones who have developed the search page, the landing page, the results page, and the resources tabs that are available within this website. We'd also like to thank Get Help, who's built the search engine or the back end of the website. We'd also like to thank the Fletcher Group, who provides technical assistance to individuals who want to establish a recovery house, and also to recovery houses who are seeking that NAR certification. We'd also like to thank the Kentucky Recovery Housing Network, which established that NAR certification process that Jonathan described. And we'd also like to thank the Department for Public Health, our partner in this endeavor, as well as the Department for Behavioral Health, Developmental, and Intellectual Disabilities, who provided integral input into the development of this service. Vimark, we'd like to thank for the marketing of the website, and last, all of the stakeholders who have participated in the focus group testing of this website to make it what it is and ready for use. We're so appreciative of your support and commitment to timely access to linkages to care for both substance use disorder treatment and for recovery support services. So at this time, we'd like to open the floor to questions. Thank you very much.
So, are there any questions? Yeah.
Before I came to the press conference, I went to the website and just thought I'd check random cities. And one of the first ones I checked was Frankfurt. And I saw 0. Is there that much of a shortage in non-Louisville, non-Lexington areas?
Well, we identified about 250 houses total right now in Kentucky, and we are still in the onboarding process. So if you look at Frankfurt, we are still developing the distance locator from it. So it will display houses, hopefully by the end of the week, from your search location. So even if you search from Frankfurt, you will come up with houses that are in Lexington. The reason there may not be houses yet on the, from Frankfurt is that they just have not onboarded yet to the website.
We can always use more.
Yes.
I'm sorry. Yeah, I'll get back to that. We can always use more houses. The Fletcher Group has been really helpful in helping establish houses. Some of the funding that we've gotten obtained through our block grants, other funding through Van's Group, other places. We've been supporting expansion of those houses, but of course we can always use more.
And it's important that if we have a limited number, that we fill every single bed with someone that's looking to be in it. So the efficiency that this is going to bring is going to make sure the resources we have today we fully utilize, and as our resources grow, we do the same.
Do you all know if any Kentuckians have tried to use this site yet for themselves, or did it just launch today where now they're able to try to do that?
Actually, I've just heard reports from about 5 different individuals just today that they were able to search on the website and use it to be able to locate houses. Now, the locating of houses and the ability for that individual to actually get into the house is based on the individual's needs. So I can't say for sure that they actually entered the house, but they actually used the website anyway to locate houses with available beds. And it's working.
Do you have any statistics that, it's a lot of times the addiction process is easier to get sober right away and then you fall back into your spot. What's the statistics of getting into your own house outside of where you're going back to where you're from and where you're, could fall back into your old habits?
Well, I've described actually 2 websites. We're talking today about the recovery housing website, but we also developed findhelpnowky.org, which locates substance use disorder treatment facilities. So that is the first step many times for an individual, especially those with opioid use disorders, to be able to get into treatment. This resource is going to be critical for those treatment centers to go into the next stage within the continuum of care to locate that house so that they can maintain recovery and hopefully maintain long-term recovery from substance use disorder. Because as you know, just going into treatment for a week probably is not going to be very effective. You actually have to go into long-term recovery.
And what I'll also say to add to that is we know that folks try recovery and start a process and fail. The governor says we're going to give people 2, 3, 4, 5, however many times it takes. I think the average is 3 or 4.
I think about 3.
So folks who begin that attempt at recovery and then have to come back in a program again. But that's why it's so important to have these services available so that when somebody is ready, they can go in.
I think it's also the continuation of peer support,
Yes.
something that is so important in treatment. And when you are suddenly in a home with other people in recovery, your ability to support each other and hold each other accountable, continues without that interruption.
Can you kind of describe how this works? Is this like a house for multiple people or individual families
There are different types of recovery houses. Some are for individuals only, but we are also onboarding houses that will accept like women with children or men with children. So if you just go into the search criteria, then that will display the houses that meet your needs. So yes, there are houses that will accept families, for instance, as opposed to individuals. And there are houses, many of them contain more than one bed for an individual.
And the NAR certification certifies a range of housing options. So it really is from sort of all the way from kind of own rules sort of situation, a couple of beds, a small home, to much larger, more structured programs. And it really is based then on how the program describes itself, but then also meets the different levels of the NAR certification.
Okay. Thank you.
Thank you.
All right, thank you.